Good morning, everybody. I am Darla Berger. I'm with the Economic Assistance side of Health and Human Services. And again, I think your packet should be the next one down on the right-hand side. And some of the things you'll see cross over from what Eric talked about. And so that's, you'll see some consistencies. And then, of course, because they're two separate divisions, you'll see some differences as well. The first couple of slides in the packet are pretty small font. If you're like me, it's a challenge to read some of those, but they're kind of a vision from the governor on what his priorities were, what his mission statement is, what they value. The next one kind of talks about our recent accomplishments, some of which you've probably seen in the news, on changes that we've made and what that impact that's had on the people who receive our benefits. And then the next one is the priorities on what we're looking forward to. And a lot of those are not economic assistance, they're more developmental disability and Medicaid related. So the first couple of slides, or probably the first page on your packet there, is actually covering some of those things. Economic assistance is one of 5 divisions within the Department of Health and Human Services. We were 6 divisions, and recent legislation took Veterans Affairs out of that and put that into Veterans Affairs, so we're now 5 divisions. Eric talked to you, he came out of Medicaid and long-term care, and I'm out of the Children and Family Services, which includes child support enforcement in our protection and safety divisions, as well as economic assistance. And then the other divisions are listed there as well: behavioral health, developmental disability, and public health. So public health is everything from licensing your water to your nail salon to your hair salon and your nurses and doctors. So we touch a lot of people's lives across the state of Nebraska. About 50% of our money comes in from federal resources, and about 45% is from state resources. And about 80% of all the money that comes into Health and Human Services is used back for services to our clients. Okay, so about 80% is returned back and used for services to the clients, and that leaves about 20% to cover some of the other programs and administrative costs. So we are a big division. I tell people we touch our youngest all the way to our oldest. So. We're going to talk about some of the low-income programs, and I'm going to give you some just real general information first, and then we'll break these down a little bit more specific program by program. There are about 24 programs that support those with low income, and these again are the SNAP benefit or food stamps. A lot of people still call that food stamps. Federal government changed that name a few years ago, about 10 years ago, but it's easy to fall back into the term SNAP or food stamps. TANA for ADC is the grant part of that. We have our aid to the aged, blind, and disabled. There's a medical component of that Eric may have talked about, and then there's the grant component of that we will talk about. Our energy assistance program, which beginning October 1, we started our heating program, so I'll talk a little bit about that. We have our social services or supportive services for aged and disabled, supportive services for children and families, and then the child care subsidy program. We have our emergency assistance program, and then the last 5 bullets there are Medicaid or Medicaid-related programs that Eric probably talked about, and I will not be talking about, but they're part of our supports for low-income families. So in general, each of these regulations, of course, come with different regulations. If you've helped clients at all, you know that some require one set of verifications, some require a different set, and that can be very confusing for the clients. Some of the things that are consistent is that we'll look at citizenship and alien status. We'll look at Nebraska residency. They need identification. We need a social security number. And then depending upon the program, we'll look at resources and their income. And we determine eligibility upon that. Within those guidelines, though, each program has specific guidelines. So the resource amount can vary for ADC, will be different than it is for the SNAP program. So within that varies. The income guidelines vary a little bit. We try to align those wherever we can so it's less confusing for the client on what verifications they need. But those programs come with different sets of regulations. So that makes it a little bit more confusing. I'm going to talk a little bit about the SNAP program. Of course, that's used to buy food items, and benefits are placed on an EBT card. In the state of Nebraska, the EBT card is light blue. It actually has a picture of the sower from the top of the state capitol. The EBT card has been in place quite a while now, probably over 10 years. That was a federal guideline from the USDA. Our SNAP program is the only program that we administer that comes out of the USDA. The other programs all come out of Federal Health and Human Services. So the SNAP program is a USDA program, a little bit different regulations, and they look at things a little bit differently. And they're the ones that mandated the electronic benefit card, the EBT card, to help prevent fraud, actually. That was a fraud prevention years ago. The SNAP program is based upon a couple of things. So your SNAP allotment is based upon your household composition, who's in that household. It looks at what the income is and what the allowable expenses are, and then that determines the amount of SNAP benefits that they'll receive. SNAP, the first part of that S stands for supplemental. It's Supplemental Nutritional Assistance Program. And a lot of people say, might tell you, I can't live off the amount of food stamps that they give me each month. Well, they're not intended to live off of. It's a supplement to your income. So that's what the S stands for in that, is a supplemental program. So we do look at who's in the household, who's purchasing and preparing meals together. There is a work requirement within that. So if somebody is not exempt for some reason, they're either going to have to be working or volunteering at least 20 hours per week in order to maintain those SNAP benefits. If they don't do that, they did not have good cause not to participate in that work requirement, they could lose their SNAP benefits. There's a student status, and that's for students of higher education. If somebody's in college or getting an education, higher education, there's some criteria that must be in place that they must be doing in order to receive SNAP benefits. Otherwise, we'd have every student on UNL and UNK and UNO's campus on SNAP allotment. So, and we're all thinking, why did I starve when I was in college? Well, there's some criteria in place that prohibits some of the students of higher education to get SNAP allotment.
Could you go over that just briefly?
So like if you're on ADC, then you meet that criteria. If you're a caregiver for a dependent child, the question was, what are some of those criteria? So if they're on ADC, if they're a caregiver for a dependent child, if they're disabled, if they're over a certain age, those are some of the criteria. So basically they have to qualify, but they have to be doing kind of something else in order to qualify, in addition to going to school full time. There's about 16 of them, I think, total. Okay. And then drug felon status, and you'll see this come up on a couple of the guidelines. The drug felon status comes out of welfare reform in 1996. It's been considered by the legislature for the last couple of years. They've talked about getting rid of that. It is not passed in legislature, so Nebraska still has that drug felon status, and you'll see it appear in multiple programs as one of the criteria that we look at. So basically, if it's sale or distribution, they're permanently disqualified from SNAP allotment at this time. If it's possession and they've done treatment, then we can do forgiveness, if we can prove that treatment, up to 3 times. The third time, it's kind of 3 strikes, you're out, and then you're no longer qualified. So the drug felon status is a criteria for SNAP. You'll see that in a couple of the other programs. And again, it's been reconsidered, but at this point, Nebraska still has that as law. Earl?
So if it's sales, then it's a permanent thing. You can't get food stamps.
At this correct time,
But if
correct.
it's possession,
Right, yeah. Sale, distribution, or manufacturing, because obviously you're not going to manufacture if you didn't intend to sell it or distribute it, yeah. But possession can be forgiveness if they do treatment. And it has to be a certified treatment program. Yep, correct. ADC, or TANF, provides financial assistance to needy children and their families. They can be living with a multitude of relatives, very common anymore for children to be raised by grandparents or maybe somebody else in their household. So in that case, we look at the relative relationship there. We have to prove that relationship either by blood or marriage. And in that case, then we can look at giving that relative an ADC check for the child. Or obviously if they're with a parent, then we can look at the ADC payment for that family. It can be a 2-parent household. In that case, both parents, one of them has to either be disabled or incapacitated in some way, or underemployed or unemployed. So it could be a 2-parent household receiving ADC if they meet that criteria. Again, you'll see cooperation with Employment First, which is our work program for ADC. In order to get ADC grant, they have to cooperate with Employment First unless they're exempt for some reason. Again, disability, caregiver, some of the other issues. We look at the cause of unemployment. Again, we look at that relationship, that relative responsibility. There is a cooperation with child support enforcement unless they have good cause not to cooperate. So if there's been violence in that relationship, we could claim good cause and not cooperate with child support enforcement. And again, you see drug felon status. If we have a grandparent who's taking care of the grandchildren, for instance, most of the time they'll look at ADC just for the grandchildren and not themselves. But we do have a stipulation that we call needy caretaker relative. So if that grandparent's not employed and they also need that ADC income, then we can also give them a payment. But if they have income, then we'll have to look at that. If they want ADC just for the grandchildren, we would not have to look at their income. So there's a couple ways we look at that when they're with a relative. Aid to the Aged, Blind, and Disabled, or AABD as we call it, is there's again a grant component of that, and Eric probably talked about a medical component of that, and that provides financial assistance to people who are elderly, in this case defined as age 65 or older. If they're younger than 65, then they have to be determined blind or disabled by Social Security Administration. And in those cases, we look at who's in the household, we look at what their income is, we look at what their allowable expenses are, and if there's a gap, we can issue out a grant payment. Most of the time, if you have somebody who's paying rent and they're getting SSI, they're probably getting a small grant from us, maybe around a $30 grant, kind of helps supplement their income. Where this is really important is if you have somebody who's maybe getting SSI, but they're in assisted living, and there's, assisted living is say $1,200 a month and their SSI is more like $735, there's a big gap. So then that grant could be issued to help keep them in that assisted living facility. So that's where you'll see it be very helpful to people in this category. There's also the state disability program, again, a grant component of that, as well as a medical component of state disability. Energy assistance. We have 2 seasons for that. Heating, which started yesterday. So our heating assistance program will now run through March. And to be considered for heating assistance, you have to be economically vulnerable. So in other words, your household must be paying their heating or cooling costs, and financially you qualify for help with energy assistance. In that case, the standard or the payment would go usually to the utility company to help you offset your heating costs in the winter months. And that's usually fairly automatic. If somebody is receiving SNAP benefits or we've got their income verified in some way, then we can usually go ahead and run that heating assistance budget without further verification. We have some people who don't receive any other benefits from us, but they request help with heating assistance in the winter months. They can apply and go through the verification process and just get that program itself if they wanted to. And again, in that case, we look at household size, the income, and then depending upon the type of heating source, the payment standard is higher. Also higher if you're in a house versus an apartment. Okay? Yes?
You said that heating piece of the utilities piece, that's automatic if you're receiving.
The question is that payment automatic? If we've got their income verified, like if they have an active SNAP case, then we can pretty much run that budget without further verification. Okay?
Do they have to request that still?
They should not have to request it unless they're not active for some reason. So if they don't get a notice pretty soon saying, here's your heating's been determined and here's what it is, then they can call in. And they have until March 31st to do that. Okay? So that program, again, just started. I've not seen the standards yet for this year. We actually run those, send the notices out, let the providers like Black Hills Energy or whoever the provider is know what that amount is going to be credited to that account. But we actually don't cut the checks till we get our money from the federal government. And I don't think that that's been done yet, or not that I've heard of. So heating assistance, again, very seasonable because that just started October 1. The cooling assistance program runs in the summer months, June through August. Again, it helps those people who have a specific medical condition where they need cooling assistance, air conditioner or other sources. It can help with an air conditioner. It can help offset their electric bill, which may run higher in the summer months. You'll notice that the criteria is a little bit different. It's more restrictive. In the summer cooling months, it's age 70 or older, or households with children under age 6 and on ADC. So it's a lot more restrictive population that the cooling assistance program covers, and that program could require that we get proof of medical need. So if somebody has COPD or asthma, we could require medical proof of that. Okay? Yes?
Is there any kind of requirement as far as like a shut-off notice or anything like that to qualify
For energy assistance, the question was, is there a requirement of a shut-off notice for energy assistance? And there is not. We do have a crisis program within the energy assistance program. So if somebody does have a shut-off notice, we want to know about that, because we can look at, not on a regular basis, but we can look at helping with a crisis like that. So if somebody does have a shut-off, they should definitely call in and let us know that they have a shut-off, and we can consider them for that. Some of the things they'll look at on that is payment history. Have they been trying to make those payments themselves? Have they received a crisis assistance in the past? Because there's some limits on that. We can't help everybody out with every shut-off. So we do have people who will rely completely on the energy assistance program to pay their utility bills. And again, it's a supplement. It's a nice benefit, but you still have the obligation to be paying your own utility bills. And so they do look at payment history when we look at a crisis for a shut-off. Good question. Yes?
To verify a specific medical condition, do you have to have a signature from like an actual MD, or does a nurse?
It needs to be a doctor. There's some specific criteria on that. And usually if we have that on file, and as long as our condition hasn't changed, we don't usually need to re-verify that for cooling assistance. Yes. Yeah, usually if we've got medical proof provided for the cooling assistance, we don't have to re-verify that unless that condition may have changed for some reason. Okay. Social Services Block Grant for the Aged and Disabled, or SSAD as we like to call it, is a great program. Probably the key thing to know about that is the sentence at the bottom there in bold. It says services are intended to keep individuals as self-sufficient as possible. So this program is available to help people stay in the living arrangement and stay self-sufficient. So it's for our elderly or disabled. It can provide a lot of supportive services like chores, which is like laundry, light housekeeping, meal preparation, respite care, adult family home and day services, meals either delivered to congregate. And this is a really good program. If you have somebody who's in their own house or their apartment, but they're struggling a little bit, they're not doing a great job about keeping things as clean as they can, or maybe their laundry facilities are in the basement and they can no longer do the stairs, then this is a good program to come in. This program, again, can help keep people independent and in their own living arrangement. And we can bring a lot of services in for a lot less money than long-term care is. So nursing home right now runs about $7,000 a month. We can bring a lot of services in through this program through a lot less money than that. If these programs get to where they're not enough, then through Medicaid we'll look at some other programs, or we might look at some other alternatives. But this is a good program to help people stay independent and stay in their own living arrangement as long as they can safely do that. Child care subsidy program, again, a big benefit to families with young children. We have a program definition of families in that case. So again, it could be a two-parent household, in which case both parents need to be doing something, either going to school, doing work, doing training. There is a need for service. In other words, they are doing something like working, training, looking for work. It's based on a sliding scale, so depending upon their income, they may have a fee requirement where they have to pay a portion of that child care cost. And again, there's cooperate with the child support enforcement and immunizations for the children. A couple of years ago, the legislature made some actions on that. You may have heard of the cliff effect. You may have remembered this being in the news. And there was people who were offered an increase in hours of work or promotion at work, and they turned it down because they were losing their child care if they took the promotion. And so the legislature passed some billing on that said if they've been on assistance in getting child care, there's more of a sliding fee to keep them on in order to work them towards independence. Yes?
Does that exist in like the foster care situation too, where they were fostering and were receiving child care subsidy and then adopt?
So the question is, if we have a foster parent who's been getting a foster care payment, now they've adopted the children, they'd have to qualify for child care assistance as a separate entity.
Okay,
It's
so
a different
that wouldn't be like a
program.
transition
Would not necessarily transition over, yes.
Is this also like the standalone, like the energy assistances where they don't have to?
They could apply for this.
Snap,
Yep.
They get the separate.
Sure, absolutely. So any of our programs really, let's say I only need help with child care, but I do okay on everything else, then I could apply for child care alone, yes. Yep. Or I could apply for multiple programs, depending.
Can you go over if they're a student component, so if they're just a student and getting child care for their kids, is that on itself alone let them get child care subsidy or?
It could. So the question is, if we have somebody who's a student, would that qualify them for child care assistance? And it could. We'll look at their income, obviously. We'll look at their school attendance and their schedule, and then they could be getting that assistance while they're in school. And that can be, I've parents that are teens that are getting that assistance while they're in high school. We also have people who are in college or are getting some other training who are getting help with childcare. So we look at their schedule and then we provide childcare during the times that they would be in class. Medicaid, Eric talked to you about. Again, that's another component of how we assist our low-income families. Any questions on the economic assistance programs?
If a parent is not, if they're getting SNAP food stamps, and then if they're not cooperating fully, will they still get sanctioned? Because it seems like it hurts the kid more than anything.
For the SNAP, yeah. The question is, if you have parents on SNAP and the parents aren't cooperating, it seems like it hurts the children when the parents are non-cooperative. And it can. You have to remember a different administration. USDA looks at that as very, we'll try to exempt wherever we can. We'll try to work with them, but it's very clear in the time that they apply that there is this criteria in place. Now, if there's children in the household, they're probably going to be exempt from like ABOD, because ABOD is our work requirement. It stands for able-bodied adult without dependents. Well, there's dependents in that home, so they're probably going to be exempt from that program. But if they quit a job without good cause, or they don't accept employment that they could have taken, they could be sanctioned, yes. Yep. Okay. I'm going to talk a little bit, I'm sorry.
That's okay. I work at Lincoln Family Medicine, and our doctors get questioned all the time about the energy assistance, and a lot of patients that come in and say, hey, I need a note from my doctor. And our doctors are like, I don't know what to write on this note. Can you tell me about like the process? Should we be waiting until we get something from the state? And then our doctor just filling that out and sending it back?
The question is to get the medical forms for help with the energy assistance program. We actually have 2 forms that we should be providing to the client that they need to take to the physician. It talks about what their health issues are, and if that's permanent or long-term or short-term. And so we have 2 forms that we normally would send out with that for cooling assistance. And like I said, once we've got that verified, then usually we don't have to re-verify that unless the condition changes.
Okay, so we just need to wait on our end.
Or ask the family for that, yeah, but we should be providing that. Yeah, and you can probably get those forms actually from our website as well if you need them. So if it's something that you'd rather do that way, I'll show you where the forms are at in just a minute.
Thank you.
Other questions? Okay, so Eric talked a little bit about Access Nebraska, and I'm going to talk a little bit about that as well. I think we actually have different paths, so hopefully, I think I heard most of that, but again, a little bit about that. Access Nebraska is now about 7 or 8 years old, and it was kind of our expansion of use of technology. So we kept basically everything in place that we had before. You'll see there a whole list of all the programs that are covered by Access Nebraska. Everything from Medicaid down to transitional medical assistance. And most of the programs that we talked about are in between there. And basically what Access Nebraska said was we want to increase our accessibility to families. So we still have our local offices. We still have paper applications for those who want them. It expanded our web-based services. So we put more things online like the application and some screening tools. Both Medicaid and economic assistance have phone applications. So if somebody maybe has a language barrier or a literacy issue or computer technology issues, they can actually phone in and do an application online for both programs. We have our local office, and we have kiosks in all local offices. There's a computer, there's scanners, there's phones available in all local offices. And then one of the things I do a lot of work with is community partners. So across the state, we have about 500 to 600 community partners. A lot of you in this room are probably community partners with us, in that we have you on our website if somebody needs assistance. If I am new to, let's say, Ord, Nebraska, I can Google Ord or that county, and it'll come up showing who's the community partners in that county. So I could go to that agency, maybe it's the food bank, and the food bank can actually help me with my application process and get applied for with our benefits. So we have about 500 or 600 community partners on our website. We still have our customer service centers. There are 2 of them for Medicaid in the state of Nebraska and 2 for economic assistance. Those are manned by state employees. They are not telemarketers, or they are manned by our state employees who've been trained through all of our state programs. We have our local offices, and then again, we use our community partners. The customer service center, because we have call centers in a different time zone. They're actually available from 7 a.m. to 6 p.m. And so if you call into the customer service center, you have a pretty good window of time in there, and they can answer questions, give you some information on your case, help determine eligibility, and help you with that phone application process. So the customer services centers are available, again, from 7 a.m. to 6 p.m. Our local offices, we have about 150 staff in our local offices across the state of Nebraska. Those local offices are available for in-person appointments, face-to-face interviews. Again, you can come in and use our phone. You can use our copy machine. You can use our kiosks. You can drop off information. You can request to see a worker. Any of those things can be done in our local offices. Part of our goal of the document imaging is to increase efficiency, so we are all paperless, similar to Medicaid. Anything that you send in is scanned in and is put in the case, so anybody looking at that can see any documentation that's been received for that family, and all of that scanning is done in Omaha. I think last month they scanned just shy of 700,000 pages of documents in 1 month. So if somebody says, well, I sent in my original, please don't have them send in the original. With that kind of volume, there's no way we can send originals back. And so again, the scanning center is very key to us, because if I get a call, if that's been scanned in on the case, I can look at that and I can see what verifications we've received. I know if we've gotten proof of that medical request. So, yes?
Where's our local office?
I'm sorry, what community are you in?
Lincoln.
In Lincoln?
Yeah.
Is in the Golds building. For economic assistance is in the Golds building. So the question was local offices. On our website, and I'll show you this in a minute, you can actually look for the local office addresses as well. So again, we're doing universal case management. Everything is paperless and scanned in. So anybody taking that call should be able to see what has been received on that case and what information we still need. Once you submit the application, we try to reach out right away. So we will text you if we've been given a text number and permission to reach out to you that way. We'll email if that's been an option that you've given us with an email address. We use letter as one of the last options because it's just a little bit slower, and we'll try to reach out by phone. So if an interview is required, we'll reach out to you in any of those ways. And again, if you need verifications, you will get a notice of what verifications are required, and I'll give you a window of time to get those verifications in. We have a voice response unit, so if it's midnight and you're like, I wonder if my food stamps have been approved, somebody can actually go into the voice response unit and check on their benefits at any time, and that is available 24 hours a day. And then just a little bit about Access Nebraska. Again, you saw this screen with Eric. You can enter in Spanish or in English. And a couple of things about this screen I just want to point out to you. On the top, on the upper right-hand corner, it's DHHS programs. So if you have somebody, you're like, I remember something about SSAD, but I don't remember specifically what it was, you can go to that, and it will give you a finer definition of all of our programs and what services are provided. There's community services, which basically takes you into 211. There's printable forms, so when you're asking about the medical forms, you could actually go into printable forms and print off the forms that you might need. The tutorials right now have been taken down because they need to be updated. There's information on the Relia card, and then contact us. So then there's an email option to contact us. Eric kind of went through some of these things with you. There's the developmental disabilities application, Medicaid application, and economic assistance application. Again, those are all separate applications now. So we always want to make sure that people don't lose that. If they say, oh, I applied and they only submitted a Medicaid application, they think they should be getting approved for SNAP benefits, we want to make sure that they realize they need to apply for whichever divisions, programs they think they need. Eric talked a little bit about reporting changes. I think that's a great tool. It's a way to go in and report a change. He gave you some screenshots of that, of reporting a change for a family. I love submitting documents. So if somebody says, I need to get these verifications in, and if you have them right there in front of you, you can actually scan those in and send them in, and you get an alert telling you that we've received the documents, and you get another alert telling you when that's been tied to the case. So it's a very nice way of tracking to know that verifications submitted have been received. There's do I qualify in that lower left-hand corner. And one of the questions you asked about was multiple programs. If you have somebody who thinks they might only apply for child care, if they do I qualify, they can go in, it'll ask them some general information about their family and their income, and it'll come back saying, it looks like you might qualify for, and it'll list those programs for you. So that's another way. So I was only thinking child care, but now it's telling me I might qualify for energy assistance as well. It's a good way to kind of help you screen that. Or you have somebody who says, I'm not sure, I was real close on income last time. You know, this is a good way to go in, do I qualify, and not be real committed, because then it tells you if it's worth you applying or not. And then on the upper left-hand corner there, a little again, my account, Eric talked about this, really important for us. It's a good way for people to manage their accounts if they've set up an account and they've activated it with a PIN number for both Medicaid and economic assistance. It can be the same ID and the same PIN number, so they don't need to keep track of two separate ones. It's a good way for them to know what verifications we've received, what verifications we still need. If they need verification of eligibility for, say, free and reduced lunch or for their housing authority, if they have an account set up, they can go in and print a history of their benefits with us, so they don't have to call us and bug us. They can just get that information themselves. So anybody who is at all savvy in setting up an account and maintaining an account should use my account and activate that with the PIN number, because it's a really good way for them to see everything on their case, their benefits, their benefit history, what we have, what we need. It's a really good way to manage that. So again, some nice tools on this website. Eric talked a little bit about my account, and again, if you don't have an account, you just go into new user and create an account, and he showed you this screen that asks about your password and your log on and your 3 security questions. And if you've got an account set up, then you can just log in and put in your user ID and your password on that. One of the things, and I think Earl, you asked about this, I have an account set up because I'll help a lot of homeless, or a lot of people who probably will never set up my account because of their use of technology or the availability of technology. And so I have an account, and so I'll go out, like when I'm doing outreach, I'll go in through my account to help somebody apply. And so anybody can set up a level 1 account, okay? You won't activate a PIN number because you don't have anything in the system, but you can do a level 1 account with your username and your password. And so a lot of your community agencies, and maybe you're already doing this, but you could set up an account that would help you go in and help somebody apply. And so then that saves some time, especially for somebody who's not going to be likely to use my account. We love to push my account, but for some people, especially if they're homeless or literacy issues or language barriers, they'll never use my account. And it's easier if you're doing a lot of applications or helping people out to set up an account for you as an agency. What'll happen when I do that, if I submit an account, somewhere on there it probably identifies that it came in through my logon, but that's all it does. It still is the client's information, the client's signature, and all of those things. So I know a lot of your community agencies that might be doing that. Yes?
So with corrections, so like, if we were to create our own profile with social worker and help them do these documents, is it gonna like list for us too, like which documents we have open? Can we have like a bunch of them that we're helping people like working on?
What'll happen is you'll go in, so if you set up an account for yourself, you won't activate a PIN number, but you put in, so mine's D. Berger, I go in under D. Berger, I help them fill out an application. Once I hit submit that application, I'll get a confirmation that that application was submitted, and then you exit out of it. And so you can keep track through that confirmation number if you want to see that we actually get that and start moving that forward. But other than that, there's really no reason to keep. You have 30 days, so if you start the application and then, I don't know, there's fire drill or whatever, and you can't get back to it, you can come back into that application for 30 days. So that's an advantage too, or your computer glitches out on you and you've just lost everything you've put in. So, did you have something else?
If we set up an account as a caseworker, will it ask our personal information like date of birth and social?
No, it'll ask your name, whatever password you want to use on that, and they'll ask the 3 security questions in case you get locked out of it. Okay? Yes?
So in that situation with the Department of Corrections, once a person, let's say you set up something for that individual, when that person comes out into the community, at that point they go in and set up.
That would be a great idea. So if you help somebody apply and then they come out of the community, in your case corrections, then they should go into my account and set up their own account, because then they can maintain their own account after that.
Okay, so the
Good question.
application, everything would be
Yes, yep, yep.
Okay.
Yep. So to do, there's like 2 levels. There's, all of us are doing level 1 account because we're not on public assistance. To get the PIN number, you have to have a case record in it, and then you get that PIN number, and you can get into my account, and then you see all the screens that Eric showed you, which allows you to maintain and change a lot of things in your own case, and get your history and see your verifications. So again, I do a lot of community outreach. For some people, it's great when they can do my account and maintain all of that for themselves. But realistically, there are some populations that, for a variety of reasons, probably will never set up my account. And so every time you're trying to do that, it's overwhelming to get the application going. You can actually have an account set up and help them apply. Okay. Any questions? Okay. Lisa?
What's the easiest way to verify like direct express accounts or accounts that don't provide bank statements?
The easiest way to verify like a direct express, if we can, we'll do a 3-way call. So if you have the client with you and you can get somebody on the customer service center, we'll do a 3-way call. If they can print off a statement, that's helpful. We need to see that current balance or fairly current balance on that. So. Yep.
Could you speak a little bit to how ADC functions, that ADC program functions with child support? We would do a lot with pregnant and postpartum women, so the time frame for postpartum women having to work with Employment First.
With Employment First or child support?
So the ADC and Employment First piece, and then when someone is not cooperating with child support.
Okay, so both kind of. Okay, so the question is how ADC works with Employment First and with child support. So again, ADC, if you apply for ADC, you have to cooperate with Employment First before they'll even activate your ADC. So that ADC case is held pending until we get that cooperation. If they're pregnant and far enough from the pregnancy that they're exempt, then they could be exempted for that time period, or just newly had a baby, they could be exempted. But when that window is done, then they'll have to be mandatory. So cooperation with Employment First is mandatory unless they're exempt for some reason, okay? And if they don't cooperate, then they could lose their benefits. Sanction 1 is like 1 month without, Sanction 2 is more, and then And ADC has a clock on it, it counts. And so there's a part of welfare reform in 1996 was that there's a limit on that. Employment First was part of the mandatation on that, but it also said they get 60 months or 5 years of limited benefits. And outside that, then they have to have a reason, like a hardship reason to get benefits beyond that. So, and again, unless they're exempt, and Employment First could be if I'm in school, that could be my Employment First plan, you know. Maybe I'm in an LPN school, and so I have another year and I can be done. That could be part of my Employment First plan, is to stay in LPN school and get that degree, work towards self-sufficiency. If I'm a high school student, that could be part of my Employment First plan. If I'm already working, maybe I'm working 20 hours a week, my Employment First plan could be that I increase my hours to lead towards self-sufficiency. So we have those contracted out, and a contractor would work with them, meet with that client, and determine what their plan is, what their goals are, and how they're going to reach those goals. Okay? Does that answer ADC?
Yeah, is there a set time frame for postpartum then?
For postpartum, it is a time period, and of course, if I think there's, you know, I think it's 3 months, or you know, I don't quote me on that. EF was not my forte, and they've changed it. So yeah, I was thinking it was like 6 or 8 weeks, or maybe 3 months. So, but there is a time limit on that. Yes. The child support enforcement part of that, child support enforcement is mandatory for most of our programs, especially ADC, unless they have good cause not to cooperate. So if they were a victim of rape, or there's domestic violence, or you know there's some factor there, we can claim good cause. They have to prove that, like a police report or medical report, and we can claim good cause and not go after child support enforcement. If there's not good cause, then child support enforcement is going to be a mandatory part of their participation. Okay, so
one or the other, or do they? It's like some families will have ADC and then they'll get child support, then they're ADC.
Oh, how the two work together.
And then, yeah.
So the question is, how does ADC and child support, when you got a check coming in, work together? So what we do is we look at the ADC payment, and we'll look at the child support payment history, and we look at a 3-month average. And if it's more advantageous to get the child support, we'll stop the ADC check and they'll get their child support. If they're receiving ADC grant from us, then the child support is maintained by the state of Nebraska to kind of pay back the ADC payment, okay? So we look at a 3-month average, and so it could go on and back and forth depending upon how reliable or how consistently the absent parent's paying child support. So we look at which is advantageous to the family. Okay. It actually runs as a debt. It shows as a debt to the state of Nebraska. So, you know, that's one thing. Nebraska's been real aggressive with employment, with child support enforcement. If they're not current, they can lose a license. They can lose a professional license, a fishing license. That'd probably get my husband. You know, fishing license, driver's license, all of those things obviously could be held. You know, so that's one of the things. And then again, we show that ADC paid out and the child support paid in, and that difference can show as a running debt to the state of Nebraska. So sometimes people, especially who are in arrearages on that or have a not current in child support, might apply for a loan, like for a house somewhere, and then it says you have a debt to the state of Nebraska. Well, it's that overdue child support. So those are some of the things that come through the Child Support Enforcement Division on that. Okay. Andrea.
Darla, can you talk a little bit about then, like somebody with a refugee status or somebody with a visa, student visa, work visa status, what they're eligible for, if anything?
Okay, the question has to do with refugees or student visas. If somebody's here on a student or a tourist visa, basically they don't qualify for any assistance, okay? If they've come in as a refugee, just like Medicaid, they've come in as a refugee, they've been invited in as a guest of the United States government, and they should qualify for all the benefits, again, depending upon their income and resources. So the Refugee Resettlement Program, we have a Refugee Resettlement Program as part of Access Nebraska. We actually contract with the Refugee Resettlement Agencies in Nebraska. So in Lincoln, it's LFS, and Catholic Charities in Omaha, it's Refugee Empowerment Center and LFS. And so when a refugee comes in, they usually tie directly to one of those agencies, and that agency helps them through the process. Applying with us, getting the verifications in, getting their public assistance benefits going. That refugee qualifies for 8 months of refugee resettlement assistance from the time they arrive in the United States. So if it takes them 2 months to get to Nebraska, 2 months of that is already gone, okay? But because they came in as a refugee, they still qualify without time-limited requirements for some of the other public assistance benefits. So if I came in as a refugee, I got my 8 months of refugee resettlement, I've now gotten a job, as long as my income still meets our standards, I could continue to get food stamps for my family, or energy assistance, or child care assistance, okay? The other statuses, so if I've come in as an immigrant from another country, then kind of like Eric talked about, there's time limits on that, and we have to look, we run that through the SAVE system and verify their status, and things are just a little bit different on those. But refugees, again, are a different criteria. Where people get confused at is people sometimes mix those terms a lot, or they don't understand, and they think they're using the right term. In reality, they have the wrong term, which makes a big difference for us on eligibility. Yes?
So for the student visa, so now the student, they are coming with a family. So the student would have like, sometimes they put F1 visa or J1 visa, but like the partner would be dependent, and if they have like G2 visa, they are allowed to work. And if they are working, they pay tax and they pay like Medicaid, or they still in this case do not get verified.
We'll look at the visa on that and run that through the SAVE system. So depending upon what the visa coding is on that can make a difference. So like a tourist visa, you know, not going to qualify. If they upgrade their status, if they stay, something happens, they end up staying and they upgrade their status, then that could change their eligibility.
But if they are paying taxes and like Medicare or something, that does not mean they are qualified.
Not necessarily. We would have to look at, the question is, even if they're paying taxes and working because they have employment authorized, again, we have to look at the status. We look at that, we run it through the SAVE system, and it has to meet certain criteria on that. There's certain statuses that qualify and some that do not. So, yes?
So for undocumented mothers who have had children here, can you talk about the benefits through economic assistance that they would qualify for?
Undocumented mother with children who are born in the U.S., right? The children will qualify because they're U.S. citizens. We'll look at parental income when we determine eligibility. Okay?
So say for a high school student with no income.
And they're applying for child care and ADC, right? Yes, then we would look at, if they have no income and we can verify that, then we would determine the eligibility for the child or children involved.
And do they get any housing benefits, rent?
We don't do housing, so that would be up to the housing authority or whichever housing agency that they're with. So, Department of Health and Human Services does not do any housing.
Can you talk about the PASS program, what that is?
Well, PASS is a Medicaid program, so I'll let Eric talk about that.
Professional Assistance Service Program. It is a factor of need, and then it's a provider-based, in-home provider-based service. Set basically on a need, and then it's built on hours of service. So home care, personal care, but it's just that, and it's a waiver service.
So when I talked about the social services for aged and disabled, and I said it's a good way to help a family support somebody who's elderly or disabled and keep them in their home, this is not medically involved. When it gets to where their needs are higher than this, or medical involvement, then PASS comes in and Medicaid takes that over. So we kind of work together. So there's an assessment done by the workers, and as they assess that person, again, if it's fairly minimal and not medically involved, then it's going to be an SSAD program. But if it gets to the point where maybe their health starts to decline or the needs are greater, then it could switch to PASS and become a Medicaid program. Yes?
Regarding the energy assistance program again, do you pay a percentage or is it the entire bill?
The energy assistance, how much do we pay? It's determined. We get a chunk of money, a block of money from the federal government, and we look at that, and based upon what our expenditures were last year and how many people we served, they determine how much they are going to pay out to that family. Again, it's higher if they're in a house versus an apartment. And it's higher if they're, like, say, propane, I think is higher than some of the other things. So it's paid out that way. So it's we just kind of try to guess to make sure that we have enough to cover everybody on that. This year, for cooling assistance, we did that, and then they had less expenditures than they thought. And so about 10 days ago, anybody who got cooling assistance got an additional $150 stipend. Because at the end of the cooling assistance season, there was a little bit of money left over in that pot of money that we had. And so they took that and divided it. And so anybody who got cooling assistance this summer within the last 10 days probably got a $150 stipend because there was some money left unspent. And so then they used that. But it's not a percentage. So like, let's say, and I haven't seen it yet for this year, but let's say just for conversation's sake, it's $350, then that's applied to their utility, to like Black Hills Energy or MUD or whichever the provider is in your area, and then it's credited on their account. So if it takes me 4 months to burn through that $350, then I've gotten help for 4 months. If I have a high utility and, it can be gone faster depending upon my...
So how can you guarantee you're being good stewards? I mean, if there's a family dead in winter, yet they're dressed like the 4th of July because they're having a...
Yeah. Well, and that's a conversation sometimes. If you have somebody who routinely comes in for crisis payment saying, I have a shut off again and again, and we look and we've been paying, we look at the payment history, and if they've been trying to contribute to that, that makes a difference, obviously. If they've not been trying to make, or it doesn't look like they've made any payments, then we're going to take that into account when we look at crisis assistance. There's a couple of programs outside us that kind of help with that. If they own their home, there's some places, people that can come in, but a lot of times it's a landlord and they don't care what the utilities, and so there's no insulation, or like you said, they have the windows open and the heat running, and yeah, so, we will pay so much, and then possibly can look at help with the shut off if they get to that point, but that's like once a year, so, Yeah.
Can you apply for the cooling assistant at any time of the year? Or?
No, cooling assistance is only in the summer months, June, July, and August for cooling assistance. In October through March is the heating assistance program.
And you don't have to apply for that?
Not if you've got other programs. It should be pretty automatic. But if you don't hear something by like November 1, then they should go ahead and go online and apply. The other thing, the advantage of applying online is that if I select the energy assistance program, the only questions it's going to ask me are related to energy assistance. So it's pretty fast and easy to apply for that. But by November 1, they should get a notice telling them, what the standard, who was credited to Black Hills Energy or whoever, LES or whoever.
Yes. Are deferred actions folks eligible for
DACA?
Yeah,
for medical, I'm not sure. DACA, are they? They're not? They're not. Okay.
and for none of these?
We will look at their criteria, so we'll look to see what their current status is on that. So.
Unrelated question. What's your guys' role with rest care? Because I know that I've called them to first. I mean, they say
call us Rest Care. Rest Care is our contractor for Employment First. So if somebody's on an ADC grant, they're cooperating with Employment First. Rest Care is our contractor. So they're the ones that would set up that plan for Employment First and what their goals are and stuff. Okay.
When I call, they said you have to make a referral. That's not.
Okay. Yeah, we would have to do the referral to them. Okay.
And how do you?
We would do that. We should be doing that automatically if somebody applies for ADC. Okay, so if they apply for ADC, we'll automatically make the referral to Rest Care because they have to cooperate with Employment First before we can look at activating the ADC.